Welcome to my presentation of investigating if the PECSS mobile app usable to proxy users. This is a thesis overview completed December 2022 in Georgia Institute of Technology, and my advisor is Dr. Rosa Arriaga. This material is based upon work supported by the National Science Foundation under grant number 1915504. Any opinions, findings, and conclusions or recommendations expressed in this material are those of the author and do not necessarily reflect the views of the National Science Foundation. The overall structure of the thesis and the presentation are first introduction, then literature review, methods and protocol, results and discussions, and at last conclusions and limitations. Post-traumatic stress disorder, which stands for PTSD, is a trauma and stressor-related disorder characterized by re-experiencing of trauma, avoidance of trauma-related situations, thoughts and feelings, negative altercations in thoughts, moods, and hyperarousal. Prolonged exposure, which is PE therapy, is a manualized therapeutic approach which has been shown to have one of the greatest therapeutic efficacies. We also know that traditional mental health is resource-intensive, costly to deliver, and still provides sparse data points throughout the multi-week therapy program. But using prolonged exposure collective sensing system, which stands for PECSS, PECSS mobile app, can overcome those barriers. But there are still a significant amount of people who reported that the smartphone is hard to use, so learning to use it becomes a source of distraction. So the usability of smartphone apps in mental health treatment has become a concern. Here are some highlights of my literature review. Scientists found that clinicians who were younger than 40 years old on a smartphone and had used an app in care have a more favorable perception than those who were older than 40, did not own a smartphone, and had not used an app in care. And System Usability Scale, which stands for SUS, is a low-cost and reliable metric for usability that can be used for global assessment of system usability. And SUS will be used in the later study. Here are two of the study aims. First, we want to collect quantitative satisfaction surveys and qualitative interviews from participants during the simulated prolonged exposure therapy. And then, we want to make use of the data come from the PECSS mobile app as well as the responses from the surveys and interviews, evaluate the usability of the PECSS mobile app by proxy users to draw conclusions. Here are specific procedures of my study. First, 3 participants are given imaginal sessions, watching a video chosen from 3 categories: serenity, enjoyment, and fear. Then all participants are given in vivo sessions for 5 days. Each day they have a different task. Then collect quantitative surveys and qualitative interviews after the above-mentioned tasks. PECSS software is used during the protocol. On the left, there are some screenshots of the PECSS software, and on the right, it is a diagram that shows our data is collected from the layers of the ecological system theory framework with Digiscape, Bodyscape, Languagescape, Imagescape, and Socialscape. For Digiscape, we collect data like application activity, audio, GPS, phone, text, and total time on app. For Bodyscape, we collect heart rate. And for Socialscape, we collect feedback from the trusted others of the patients. And for Imagescape, we collect image captures from in vivo homework. For Languagescape, we collect audio from the in vivo event. Before the study, all participants are required to complete the pre-trial survey, and the questions on the pre-trial survey are highly related to the study. In the responses, we find some very interesting patterns. 6 of the 7 people are male, and most of them did not use a Fitbit tracker before. None of them have sat in tech room by themselves, and 4 of the 7 people only exercise a few times a month. Here are some examples of the data collected during the study. The figure on the left is the audio data for participant 3's first in vivo session, and the figure on the right is the app usage and activity data extracted from our PECSS server from Postman, recording the 5th completed assignment for participant 3. After the study, all participants are required to complete the post-trial survey, which is based on the SUS scale we discussed earlier in the literature review session. SUS is a 5-point scale ranged from strongly disagree to strongly agree. For the odd number questions, the higher the scores are, the higher the usability is. And for the even number questions, the lower the scores are, the higher the usability is. Our usability score is 75.36, which is a lot higher than the general system score average, which is 68. However, we still notice that the lowest score comes from participant 4 with only 52.5. In the later interview, he explained that he wished there could be more guidance on how to use the application itself instead of having a technician aside helping to work through it. He said, "Without you helping me aside, I don't think I'm able to do all those things on my own." Then, we conducted qualitative interviews for participants asking about their concerns and recommendations regarding to PECSS mobile app. Their concerns and recommendations are mainly focusing on content and UI. Some people said wish there can be more guidance on specific tasks in my homework, and some said some functions are not well phrased and involves many technical terms in psychology that is somehow complicated for me. But this will be less a problem in the real PE therapy because patients will know the psychology terms better. And for UI, some people said there are some inconsistency for the displaying of the content. Sometimes the content overflows my screen. And some said reminders in the form of push notifications will be great. And some said when starting the in vivo, the text boxes to enter pick and post SAT should be made invisible. Those concerns and recommendations are very valuable for our future development. At last, here are the conclusions of this study. First, this study shows a promising result that most of the proxy users in the study find that the PECSS mobile app is easy to use, easy to learn to use, and easy to become proficient at using it. Second, participants give very valuable suggestions for the future development of the application, including both aspects of usability and functionality. Third, with higher usability, patients may be more motivated to use this application and may receive more efficient support from their clinicians. However, there still exist some limitations of this study. Our data comes from self-report measures from proxy users. Data does not include a clinical review. We have used a convenient sample of college students, so sample characteristics do not represent the PTSD populations. Both the imaginal and in vivo session in the study are less than or equal to 15 minutes, but these last at least 30 minutes during clinical sessions. Thank you for listening to my thesis overview. I want to say special thanks for Dr. Rosa Arriaga, Peter Presti, and all members in the PECSS team.